Welcome to Clear on Health.
Good evening, viewers. Welcome to our program Clear on Health on African Health Television on TSTV. My name is Dr. Fumilayo Elusoji. With me in the studio is Mrs. Jane Abor. Today we are with you. Yesterday we met to talk about, the postnatal period and, what to expect in the postnatal period, why it is important, and then what the things that can come up in the postnatal period that you need to be aware of. So today we're going to be talking about breastfeeding. Now, breastfeeding simply means you are feeding the baby with breast milk. And there are certain things that, that are around breastfeeding as a topic. Now, there's something that is commonly associated with breastfeeding, which is called the Innocenti Declaration. In August 1990, some organizations came together with the World Health Organization and UNICEF, to sign a document so that that declaration was passed, and it states that women should be allowed or enabled to practice exclusive breastfeeding, and then they said a child should be breastfed for about 4 to 6 months exclusively. Now, this was to promote maternal and child health and nutrition. So this was a declaration that was passed because they wanted to ensure the efficacy of breastfeeding. So, why is the world so concerned about breastfeeding?
The world is interested in breastfeeding because of the importance, the gain, what the child has to gain from the breast milk, and also the effect of the mother breastfeeding the baby on her own stature, on her own maybe physical stature, or the benefits she stands to gain by breastfeeding the baby exclusively. And one of it is that another description for breast milk. Breast milk has been described as one of the strong illness inhibiting food for babies. Okay. Because of the content of the breast milk. The breast milk is highly nutritious for a baby that is just brought to life, at least for the first 6 months of the baby's life. There are so many benefits that are attached to breast milk for the baby and even for the mother. And one of it is that it has been discovered that breast milk is highly nutritious for the infant. There is no allergy on breast milk. That's to say that there won't be a reaction on the part of the child. Unlike the complementary feed, the children are bound to react and then be manifesting in form of diarrhea and all manner of childhood illnesses. But for breast milk, there's no such reactions at all. And it has also been said that babies who are exclusively breastfed, there's a level of their intellect. It builds their intellectual capability in future. They are highly intelligent. That's one of it also. Then another benefit again is that it's of no cost. The present situation at which we are. So there's no family that can say, oh, I can't breastfeed my child. Unlike the stress of going to look for money to get formulas and other means. This one is readily available. Nature has made it so. God has provided this for us free of charge. And it's very, very convenient for the mother as well. Yes. You don't need to buy anything like a feeding bottle and also preparing on the sterilization on the feeding bottle. You just put the baby to it and it flows and the baby is just sucking and the mother and the baby are enjoying themselves, which brings about bonding between the mother and then the child. Because when you see a child that is well lashed on the nipple and is sucking, is looking at the mother, is just enjoying himself or herself, that creates much closeness between the mother and then the baby. Yes. That's another one also. It contains antibody as well. It builds the baby's immunity. A child that is well fed hardly falls ill. True. Even though some babies, it's expected that when they are being breastfed, they should blow up. But even for a child that maybe couldn't add up much weight, the immunity is there.
Yes.
That child immunity has been well built up.
Yeah.
It is also easily digestible. Children who are breastfed, there's no issue with diarrhea or any kind of gastrointestinal problems at all. That's why we encourage women, and that reminds me as well, because some of them will come to tell you, since the past 3 days, 4 days, my baby has not gone to toilet, he hasn't food. Don't bother, so long as you're being exclusively breastfeeding the baby.
Yes.
Yes, because everything is well absorbed in the baby's system.
Yeah.
So, and then on the mother side also, learn that mothers who breastfed their babies are bound to be free from ovarian cancer and also breast cancer.
Yes.
That's good thing on the mother. Also helps in involution. For mothers who breastfed their babies, they hardly suffer some involution.
Yes.
That is the pregnancy, the uterus coming down from being an abdominal content to a pelvic content easily within the stipulated period of time. Yes, that one. And lots, there are so many benefits that maybe time might constrain me to mention them all. I think because of the benefit, that is why the world has placed so much
emphasis on it. Yes.
On breastfeeding.
Yes.
Or breast milk.
Yes, that's a good explanation. But I think there was one thing I got from what you were saying was the fact that it doesn't cost so much.
No.
It's just you have the organ in your body, so you can easily just give your baby your breast, and then baby is being fed with the necessary things. Yes, necessary things that they need, which is very important. So, Ma, when after delivery should breastfeeding be initiated? Because some people will say, should we wait for 1 week? Maybe breast milk is not coming out. Let me take my time and do other things and maybe leave the baby for some time. Maybe the breast milk will come on its own naturally without you putting your baby to breast. So when is the ideal time for breastfeeding to be initiated?
Immediately the baby is born, even while the placenta is still in the uterus.
Okay.
Like what we're taught is from the baby, on delivery, when we talk about the mechanism of breathing, when the baby is born, once the baby is delivered, you just place the baby on the mother's chest, and then the next thing you put the baby to breast.
Okay.
That even also aids the contraction of the uterus to help in the expansion of the placenta.
Wow.
So immediately the baby is born. And just like you're saying, it's when you put the baby to breast, that is what will initiate the breast flow, the milk flow. Because as soon as the placenta is born, the hormones that are responsible for the pregnancy and the placenta, the ways of the body, and once the suckling effect is sent into the brain, the hormone, the prolactin that is responsible for the flow of breast milk, sets in and begin to work. And the suckling effect has a lot to do with the stimulation of the hormone for the breast to pump. So as soon as the baby is born, even while the placenta is still in the uterus, the baby can give breast.
Yes.
But on the other hand, you can wait until even after you just clean up the woman. Where we always encourage them, why before you go into active labor, take a shower. For a woman who has taken a shower before she goes into active labor, there's no even point of cleaning. Just put the baby to breast. She's clean, and then the baby can begin to suck. And as the baby sucks, breastfeeding has been initiated already.
Wow. Okay. So, while you were talking, I now remembered, I thought of a question. How often should the baby be breastfed? Because some mothers will say, oh, the baby is sleeping. Baby is sleeping for 2 hours, 3 hours, 4 hours. You say baby is sleeping. And they don't feed as frequently, because there's also a concern of if the breast milk is enough to give the baby the kind of weight that is desirable at the child's age. So at what time do we say, how often should baby be breastfed with breast milk?
Babies should be fed on demand. But for babies within the first 28 days, once, you just have to wake them up to feed them. I don't know whether, I'm not really sure whether the stress of labor or whatever. The first 28 days, they are always sleeping. So you just have to wake them. If you are waiting for them to wake up to come and suck or to cry for hunger, you might just be starving that child. So when we encourage them, you like stimulate their food.
Okay.
When you notice that they have slept for 1 hour, 2 hours, 3 hours, and they have not been fed, stimulate their food, wake them up, and put them to breast. And you discover immediately you put them to breast, they'll begin to suck. So you, the mother, you'll be on a watch at that point. I'm talking about the first 28 days.
Okay.
Yes. But thereafter, as soon as the child wants to suck, even if it's 2 hourly, 3 hourly, or even 4 hourly, just put it this way, that the baby should be fed on demand.
On demand.
Yes, at every time that the child wants it, you feed them.
Yes. But the first 28 days, we can feed at least 2 to 3 hours.
Yes.
That child should be
2
fed.
hours,
yes.
Or so on, or even 2 to 3 hours.
Yes.
Even when they are asleep at that period, wake them up.
Yes. It's very, very important, so that you don't assume your child is so sensible and they are asleep. They are not adults. You have to, determine certain things for their life to, turn out the way you want it to turn out. So, Ma, let's talk about the latching of the baby to the breasts. How do we advise mothers? I know these are some of the things we talk about in so maybe the tail end of antenatal clinic. How do we advise mothers to, put their baby to the breast, to latch on to the breast, and then so that the breastfeeding mechanism is effective enough?
There's a posture that has been described by World Health Organization on the latching. And you put the baby's head, I don't know how to describe it here now, but in whichever way I can, the baby's head should be around your elbow.
Okay.
And then your palm supports the bum bum.
Yes.
So the baby is just between your arms like this, so that you can lift the baby to your breast. All we are trying to achieve is a comfortable position. We are trying to achieve an effective breastfeeding position.
Yes.
Because if the baby is not properly positioned with the mother is bound to suffer backache, and that will hinder breastfeeding.
Yes.
And we don't want anything that will hinder breastfeeding. But with this position, you can comfortably sit, and then all you need to do is to lift the position of your breast, and then you latch the baby on the breast.
Yes.
And you make sure that the baby grabs the nipple and let the nipple go beyond the tongue, so that how can you notice that? When you're hearing the swallowing of the baby. Some babies, some mothers have just put their babies to breast, and all you'll be hearing kind of some sound like this. Well, for a well-latched baby, there shouldn't even be sound, anyhow sound. All you'll be hearing is just the swallowing reflex.
Okay.
Yes, and you know that the baby is properly latched on the nipple.
Yes.
The black covering of the nipple, which we call the areola, should be covered with the baby's lip, and then the nipple goes right under the tongue. Above the tongue,
yes.
And then the milk is just flowing. The milk is just flowing. And there's not even point, like, some mothers will want to, like, express it. No. By so doing, you are even trying to block some of the ducts that supplies the milk. Just leave the baby to the breast. So long as you're in comfortable position, once you're comfortable, you can be there. The baby can be there on the breast for 1 hour or even more, and it's just sucking and sucking.
Yes.
But whereby the position is not comfortable for you, you won't be able to breastfeed the baby for so long.
Yes.
Because you might have some aches at the back or even down your waist, and that won't really promote effective breastfeeding as we want.
Yeah. Thank you so much, Ma, for that answer. I like the way you were so practical to, explain the way the woman has to sit down, the position she sits down, how to position the baby, and then the amount of the part of the breast that is covered by the baby's mouth to ensure that the baby is effectively swallowing the contents of the breast milk. So that's a very good explanation, and so I hope that we're able to understand what we meant by effectively latching the baby to the breast. Thank you so much, viewers, for listening to us so far. We'll be going on a break shortly, and then when we come back, we'll continue talking about breastfeeding. Thank you.
To recharge your TSTV decoder, simply log on to www.buytstvvouchers.com. Click on sign up, fill in your details, name, email, phone number and password. Click on create, then log in with your email address and password. Click on buy voucher, select the voucher of your choice, pay with your card or wallet. Enter your decoder serial number and voucher pin, click on load, or you can get your TSTV voucher from our dealers nationwide. You can also contact Kalak Power on numbers and details showing on the screen. TSTV, connecting your world.
And welcome to Clear on Health.
TSTV, connecting your
Viewers to our program Clear on Health on African Health Television on TSTV. My name is Dr. Fumilayo Elusoji and I'm your anchor today on this program. With me in the studio is Mrs. Jane Abbo and we'll be talking about breastfeeding, why it is important, why the world is so concerned about breastfeeding and why they advocate for exclusive breastfeeding, especially in the first 4 to 6 months of a child's life. So before we went on the break, we talked about breastfeeding, we introduced it, and then we also talked about how we can properly position the baby and, to latch to the breast and, ensure that baby is effectively, taking enough breast milk. So, Ma, there's something that people usually think. They think that breast milk is not water. So you see people say the child is taking breast milk, but we need to give the child water. The baby needs water. So, Ma, is it important to add, water to breast milk when a child is supposed to be on exclusive, breastfeeding, especially in the first, 4 to 6 months of the child's life?
No. When you look at the content of the breast milk, the highest percentage is water. By World Health Organization said it's 80%
Yes.
of water. So that means there is sufficient amount of water that will hydrate the baby for that period.
Okay.
So what we are trying to say invariably, there's no need of introducing water once the child is being exclusively breastfed.
Okay.
You don't need to give water at all. The water content of the breast is enough to sustain that child for the first 6 months of life.
Yes.
Yes. So, and that is the essence of this teaching, because a lot of them have been so confused. Even our mothers, like we gave you people water when you were born in addition with breast milk. But study has been carried out to say that the majority of the content of the milk is water. So what is the point of giving the water so long as you're not introducing other food to this child and it's just the breast milk?
Yeah.
That child is well hydrated. So it doesn't need any extra water from you.
That's a good answer. Thank you so much, Ma. I hope we're clear now on whether to add water to breast milk or not. So, Ma, what are some of the foods that help with breast milk? Like, what are some lactogenic foods? We call them lactogenic foods. Any food that can help the mother produce milk. What are some of those foods especially in our environment?
Okay. Like I saw in the definition of lactogenic food. The word lacto is a Latin word which means milk. And then genic means producing something. That is food, something that can produce milk. That is lactogenic food. So lactogenic food are any kind of food, herbs and spices that have some specific nutrients which support the production of breast milk.
Yes.
Or the food that you eat and is able to help you produce milk. It's a lactogenic food. And then when I studied it, I discovered that every food a woman eats that it's able to sustain her and also help her to produce breast milk is lactogenic. So, but when you look at it or when you Google it, there are some specific kinds of food and spices or even herbs or vegetables that's been listed out that could help a woman produce milk. But let's put it on our context. Any food at all that a woman can eat that can make her, that can aid her in the production of breast milk is just fine. In our own African setting, then Nigeria in particular, all the foods are available for the women. We don't want to put conditions so that we don't stress the family, stress the woman or the husband to say, get this particular one, get this particular one. Our mothers of old, they were just eating. All they know is that at that period, a woman should eat well.
Yes.
A woman should rest well. A woman should take enough of fluid diet. Once you're taking fluid diet, there is no how your breast will produce milk. And then we have a lot of them in our Nigerian setting. The ones that are popularly called kunu. It's a very good sauce. Pap, akamu. The local diet.
Yeah.
It's also, those ones are made from cereals.
Yeah.
Yeah. They are very, very good in the production of milk.
Yes.
Then green vegetables. Things that has folic in them. They are very good also in producing milk. And then all the vegetables you know you can afford to buy and to eat. It will also help. Then even spices too. Spices are ginger, garlic. Yeah, they are all good sources also of lactogenic herbs. Yeah, that will help the woman. So in essence, any food at all that you can eat, that can give you energy, that can sustain you, will invariably help your breast to produce milk, and then you can have enough to give to your baby. But we emphasize more of fluid diet. Take a lot of fluid diet. It will really help in the production of milk. And also take liberal water as well, so that you, in the process of breastfeeding the baby, you don't go dehydrated.
Thank you so much, Ma, for that answer. So when we talked about the Innocenti Declaration, we mentioned it as a way that, it's to ensure that, women are supported to exclusively breastfeed their babies. Now, different organizations have different times they give women to go on maternity leave. So you have some organizations that will say 3 months, some will say 4 months. This was to help the mother, bond with her baby, breastfeed exclusively without interruption. So what if the mother has to be away from her baby for some time? So let's say her maternity leave is over and then she has to go back to work. How are the ways that she can, sustain that breastfeeding practice? What are the things that she can do?
Yes, like we are Nigerians, and we are talking based on Nigerian context.
Yes.
The whole country, based on World Health now, is in support of exclusive breastfeeding.
Yes.
So, like working class women, in most offices they have crèches where they put their babies.
Okay.
And the essence is just to allow accessibility of the mother and the child, so that while you're at work, at every point in time, you can rush in to check your baby and also to breastfeed your baby. But in some institutions where such is not available, the woman also can express. You can express the milk.
Yes.
And you can store. If you express the milk and store in just this normal cooler, it can last up to 4 hours. If you store it in the fridge, it could last up to, if there is regular electricity, it can last up to 4 days.
Wow.
And if you refreeze it, the freezing can last as long as there is light and it remains frozen. So that when you want to give to the child, you bring it out, defrost, and possibly maybe warm it up. Warming it is not putting it on the fire. Maybe in hot water, put it in the cup and just leave it there so that you don't give it to the child cold. Yeah. So these are the ways that the breast milk can be preserved. But any other way, it's milk. It's milk containing. It can easily get fermented, which could have a negative effect on the child. So these are the ways to do it. So as much as possible, we encourage women to put their babies on crèche, or maybe crèches, or a crèche that is close to your workplace. And if you have someone that is looking after your baby, you can always bring the child, your baby with your house help
Yes.
to stay close to you so that you can always rush in to feed the baby on demand. But where these two are not available, another option is to express the breast milk. Yeah, you can express it manually. For someone who has a good flow of breast, you can easily express it manually. But if you're having difficulty, there is a pump, breast pump, that can aid you to express your breast. Check the quantities that the baby can take per the duration you're at work.
Yes.
So that you express the much that could take you for that period.
Yes.
And I learned also that the best time to express and get enough quantity is at night. So maybe at night you could wake up and express so much of it and store in your refrigerator. And then in the morning you can put in your cooler or stand to work. You feed the baby until the closing of the hours and then you come.
Okay. Thank you so much, Ma, for that explanation. So, Ma, how do we sterilize breast milk utensils or, equipment? How do we keep those things? Because, there's also especially if you're going to be expressing breast milk and storing, you are going to store them in certain things, and then you are going to have to give the baby with a bottle or something to drink. So how do we sterilize those,
No, for breast
utensils?
milk, there is no big deal. Like that's one of the advantages or the benefits of breastfeeding too. You can you're carrying it about, but whereby there is the need for you to express it. All you need to do is to get the container. You get the container at which you want to express the milk into.
Yes.
If you're manually going to express it, all you need to do is to have some soapy content of water so that you wash your hands before you express. But then if you're using a pump, there is this sterilization tablet. After you have expressed with the pump, you wash them very well, raise them very well, and put them in the water and drop the tablet.
Okay.
I think it's called meeting also. There are other different brands
types.
as well.
Okay.
You leave it there for some time. Then after, when you want to use it, all you need to do is to take it out of the water, raise it in the clean water, and then put the breast milk and feed the baby again. For the breast milk, there's no much big deal as in the sterilization of the instrument you're using.
Yes.
Or, like the cup and then the spoon, or if you're using feeding bottle. We advise if you express it, you can always use a cup and spoon.
Yes.
It is best. It's the best way of feeding the baby.
Okay. Not the feeding bottles.
Not the feeding bottle because of the complication of the feet. That's the feeding bottle.
Yes.
So we advocate for cup and spoon.
Okay.
And once the baby gets used to that, by the time you introduce solid into the baby's milk, it's also made easier. Like pack or whichever cereal you're using to use the cup and spoon. And also another advantage of that, it gives the child independence. Whereas the child is growing up, the child will learn to feed himself or herself early and faster.
Just because of the, already knowing how to use cup and spoon.
Exactly.
Okay. Thank you so much, Ma, for that explanation. So viewers, we'll be going on a break shortly, and then when we come back, we'll keep talking about breastfeeding. Thank you so much.
Welcome to Clear on Health.
Welcome back, viewers, to our program Clear on Health on African Health Television on TSTV. My name is Dr. Fumilayo Elusoji. With me is Mrs. Jane Albo, and we've been talking about breastfeeding. So before we went on the break, we talked about sterilization, how to stop breast milk, and we also talked about earlier about proper positioning of the mother to breastfeed her baby. So Ma, what are some of the conditions that breastfeeding is contraindicated? Because we're advocating strongly that every woman should breastfeed her baby.
Yes.
So what are there conditions that is prevented or that is not advised?
Yes. There are some conditions the women suffer or the treatment they are on that contraindicate breastfeeding. And one of such is any woman who has an infectious disease such as tuberculosis and also is on active medication of that infection. Yeah, such a woman is not advised to breastfeed her baby. A woman also, like a woman who has cancer of any sort and is on chemotherapy, she's also not advised to feed her baby. Even a woman with a venereal disease also is also advised not to feed her baby. And then a woman who is HIV or AIDS positive that is not on antiretroviral, she's also advised not to feed her baby. But let's make it clear, a woman who is HIV positive or AIDS but is on antiretroviral and they have checked the viral load and is at a considerable quantity, can breastfeed the baby on the ground that the baby also is commenced on antiretroviral. So let's make these two things clear, because some of them they will just say no, don't breastfeed. But by what I understand, if a woman's viral load is low and the baby has also commenced the antiretroviral and she herself is on antiretroviral, she can feed the baby. But what they do is that they keep checking. They keep checking the baby. They keep doing this PCR.
Yes, just check.
Yes, on the baby to see whether and so on. So they keep monitoring such baby. So such a woman is allowed to feed
her baby.
Yes, feed her baby.
And
then on the side of the baby, there is this condition called PKU.
Phenylketonuria.
That's on the part of the baby now.
Yeah,
baby with such conditions is contraindicated as well, because they say the baby lacks some amino acids that cannot break down the breast milk. Yes. Then another condition as galactosemia as well too, on the side of the baby too. All these are rare conditions anyway that the child will suffer and can't tolerate the mother's breast milk.
Yes.
Yeah. So such a baby too is also contraindicated. But outside of health conditions or health grounds or your specific therapy, I think every woman is advised to feed their baby with their breast milk.
Thank you so much for that explanation, Ma. We are advocating for exclusive breastfeeding. That's one of the importance of this our talk and our program. So Ma, what are some maternal problems that are encountered during breastfeeding? Because we are advocating so much for it, but we know that every woman would react differently to breastfeeding. New mothers will see happening in their body. It's something they've not done before.
The condition one is what we call mastitis. That is the inflammation of the breast tissues. The breast just gets swollen. There won't be milk coming, and then the breast is swollen, it's tender, it's hot, and it's very painful. And the essence of breastfeeding is for both mother and babies to enjoy themselves. Whereby a woman is trying to feed the baby and is having pain. That's one of the conditions. Then another one is breast abscess. So these conditions, some of them are rare. They are not very common. But the breast abscess, I think there was 1 year it was common. Almost among some women that came to deliver. That was when I was doing my nursing training. Yeah, they were suffering from breast abscesses. So that is one condition too that will not permit a woman to breastfeed her baby. And then there is this cracked nipple. But that one boils down to antenatal as well. If a woman carries out effective antenatal lessons, they are being taught during the antenatal period on how to care for the nipple, so that at the end of the delivery you have a patent nipple, so that you can have effective breastfeeding with your baby. But whereby a woman that did not benefit from such knowledge could just be careless with the breast, well, with the nipple, and then the nipple is covered with debris, and then after delivery you discover that it blocks the duct. The patency won't be there for the milk to flow. And then in the process of forcefully doing it, it will crack and then gives her some pains. But there is a common treatment for cracked nipple. All you need to do is to lubricate. Lubricate it with any lubricant at all you have. Even ordinary Vaseline will do.
Yes.
Or mentholated, what's it called? Mentholator.
Mentholator,
yes, that can also help. Then just soften it, wash it gently with your hand, and that will solve that problem.
Yes.
And then so women, their breast flow is so excessive. So women with such excessive breast milk flow will also have issues as well. It's really a distressing thing for them. For them to Then another one is engorgement. Engorgement is also close to women who produces much milk, and then the sucking ability of the baby is not balancing with the flow of the milk. So there is so much accumulation of the breast milk leading to engorgement, and it can be very distressing. Yes, it can be very, very painful. Then on the side of the baby, congenital malformation could be a condition that could hinder effective breastfeeding, such as cleft palate, cleft lips, all the congenital malformation that will affect the mouth, the tongue, the palate, and so on. It won't permit effective latching of the baby's mouth or the breast, and that could contraindicate
effective breastfeeding. Yes, thank you so much, Ma, for that explanation. I like the way you broke it down to explain, certain problems in the mother and the problems that can be encountered in the baby. While you were talking, I remember that we talked about latching and how the mother positions. Does that have anything to do with the problems that can arise, maternal problems with breastfeeding? Is it if the baby doesn't latch properly to the breast?
Yes, especially with the sore nipple.
Okay.
Yes, when the baby did not latch properly on the nipple, the nipple is bound to get sore. Because the gum, even though they are babies and though their gums are tender, but there's a way it has effect on the nipple. And then before you know it, with time, the nipple gets sore. And then as there's that compassion, you want to feed your baby despite the pain, but then it's no longer effective because the pain is already there. So cracked nipple is one of it. Now, even some women, even with the abscess, they still want to proceed to feed the baby.
Is the milk going to be healthy enough with an abscess? That's another thing, because there's an abscess and then you're feeding the baby because you want the child to have. Is it going to? We say the milk is, because I know it's going to cause pain for the mother. But is the child going to get anything that is going to be nutritious as usual?
No, the breast milk still remains the breast milk.
Okay.
Because sometimes the abscess is not right on the nipple. Maybe on one side of the breast.
Okay.
So all you need to do is to take care of the
abscess. Okay.
But the milk content remains the same. Once she could tolerate the baby to latch on the nipple.
Wow. That's a lot of stress. Mothers are trying. We need to give ourselves thumbs up. Okay, Ma, thank you so much for that explanation. So the viewers, we're going on a break, and when we come back, we'll keep talking about breastfeeding. Thank you.
And welcome to Clear on Health.
TSTV, connecting your world.
Viewers, welcome back to our program Clear on Health on African Health Television on TSTV. My name is Dr. Fumilayo Elusoji. I'm your anchor today. With me in the studio is Mrs. Jane Abel, and we've been talking about breastfeeding. So before we went on the break, we talked about certain maternal conditions that makes breastfeeding uncomfortable. So now, we're going to be talking about the role of the husband in breastfeeding, because we know that the breast is a part of the body that is in a woman, but the baby is produced husband and the wife, so there should be some contribution he should make to make that process an easy process. So what are some of the roles that he can play so that the woman is relaxed and able to carry on that process effectively?
Just like you rightly said,
Yes.
it's true. That's the husband and the wife
Yeah.
bring forth the baby into this world. So the man has a role to play so that the mother and the baby can have a effective breastfeeding.
Yes.
So one of the roles is psychological support. The woman needs the support of the man
Yes.
at that point.
Yes.
Even though it's a woman thing, but then we still need the support of the men. Let me even go back to antenatal period. Yes, right from the antenatal period, even when we discussed about antenatal, we talked about the importance of the man coming with the woman for antenatal, or his role during the antenatal period. And we mentioned one of them too has been the psychological support,
Yes.
apart from the social or financial support that he gives the woman.
Yeah.
Then when we're talking about the condition that could make breastfeeding difficult, one of it is the cracked nipple. The man also has a role that he needs to play on that aspect as well. The woman is yours. You own her body and otherwise as well. So there is no shame about it now, because the essence of this is just to educate our women and also the men as well.
Yes.
For a woman who is suspected to have or bound to have a cracked nipple,
Yes.
the husband can play a role by beginning to suck the nipple even before the arrival of the baby, and that will clear the debris.
Wow.
Yes, and by the time if you discover that your nipples are blocked, because once you're pregnant, the breast keeps secreting milk, and then if it is not washed up, it gets thickened to it. We are just using the plain and layman language that the women can understand as much as possible.
Yes.
So it gets thickened and darkened on the areolas, on the tip of the nipples.
Yes.
So, but if a husband is constantly sucking the breast during the antenatal period, there won't be need for that.
Yes.
There will be that patency, so that once the baby is born, the breast milk can flow. So that's one of the roles, and that's antenatal role that the man needs to play them. And even when the baby is born, like I talked of, one of it is excessive flow of the breast milk. At such point that because what brings rise to that is a balancing, the imbalancing of the baby not being able to suck enough of what the mother is producing. The man can play a role. He can suck that out. If he like, he swallows it. If he like, he can just suck and pour it out. And so to reduce the quantity of the flow, so that the baby can cope and the mother also can be a lot more comfortable.
Wow.
Yes.
That's a lot of
Okay. Can be a lot more comfortable with it.
Yeah.
And then for women also who are bound to suffer from mastitis or breast abscess also, and the tender loving touch of the man too. It goes a long way in healing the abscess, yes, because even locally, another of treating abscess is using hot water with a clean towel to apply, and that will also give some relief to the woman, and she will get more relief that is the husband that is doing it.
Actually, she's more comfortable.
Yes, and also the main thing again is the man ensuring that there is enough in the house for the woman to eat. Enough of the lactogenic food we talked about. Let them be enough, because you discover that even in the period of breastfeeding, there are some families that the woman is not eating enough. But the babies are parasites. Whether the woman eats enough or not, the breast milk must produce. Then the woman will be the one at the receiving end.
Yes.
So the men, please make sure that there is enough apart from the psychological support and the rest we've talked about, make sure there's enough for the woman to eat.
Yeah. Yeah.
We're not talking of expensive food. The available food within your locality, make sure it's available so that the woman will have enough to eat.
Yes.
The woman needs it at that point. And then support her to even at night, because another thing that creates the flow of breast milk again is rest. Good sleep. And you know, when you put to bed at that point too, there's not enough rest. So at some point, because sometimes even the babies, even when they are not hungry, they decide to be awake. So at such point, if they are awake and they are not crying, the men can be awake playing with the baby so that they can take some rest and take some sleep. That's another support. No, it's not right that the man will just neglect the woman, go to a different room, and then leave the woman, the baby struggling all through the night. She's struggling with the baby, and when the day is broken again, there's no time for her to rest. Visitors are coming. She needs to attend. She's a woman that has children before. She needs to attend to the other children, attend to visitors, clean the house. There's no time for her to rest. That will really affect her health as well. So the men too, they need to support her, be by her side on the bed, so that when the child is awake and is not crying for hunger, you play with the child while the woman takes us down and just relax her brain. And lots other things. We just need the men all around us at that period.
Yes. Thank you so much, Ma, for that explanation. I think the men can bond with the baby too. So it promotes not just the mother bonding, you are also bonding with the baby. So it's really important that they are involved in this care, in this activity that is happening, even if it's the woman that has the organ or the breast organ, and she's the one that can feed the baby.
And when the woman expresses as well. Once the woman expresses, the man can give. At that point now you can give the breast because already the woman has expressed it out of her breast. So the man can at that point take the baby off the woman and feed the baby with the milk produced by the woman.
Thank you so much, Ma, for that explanation. It's very profound, and I think some people are hearing some things for the first time. So we've been talking about breastfeeding. We've talked about the importance of breastfeeding, why the world wants children to be exclusively breastfed. That it helps with maternal health, helps with the child's health and nutrition. There's a lot to gain from today's discussion. Thank you so much for joining us. Thank you, Mrs. Abo, for coming on the program and sharing your wealth of experience with us. Thank you so much for joining us. Till next time, when we meet on this program on Clear on Health and talk about other things that affect your health. Thank you.
And welcome to Clear on Health.
TSTV, connecting your world.
And welcome to Clear on Health.